So we're going to look at infancy stage of growth and development. A normal human being grows in two sets. We have prenatal, which is commonly known as fetal or intrauterine growth. And then we have postnatal. So for us, when we speak about infancy stage of growth and development, we are postnatal. And the stage of postnatal, they include a newborn, an infant, a toddler, a preschooler, a school age, and an adolescent, and then up to adulthood. For the sake and the purposes of learning, we have infancy that can be divided into neonate and an infant. Now, a neonate is from birth to end of 28 days. And then for an infant is 1 month to end of 1 year, end of 12 months. Then growth, it's quantitative, an increase in size and number of individual cells, increase in size and number of individual tissues, organs, then organ systems eventually, and an ultimate increase in size and height of an individual. Whereas development is an increase in complexity of individual cells, tissues, etc., without or with growth. It's more qualitative. So the factors that affect postnatal growth, they can be divided into intrinsic and extrinsic. Intrinsic are hereditary. They can be emotions, the hormones, whereas extrinsic, they are environment, the nutrition, the time, the culture, the change in seasons. So the characters of growth and development include it is continuous. It's a process from birth to old age. And it is a predictable sequence. The body parts grow at different rate and time. Each child grows in his or her unique way. Not all children grow together or in the same way. It's regular. It's cephalocaudal from the head to toe. The head grows faster than the neck grows faster than the upper limbs. The upper limbs will grow faster than the chest. Then it's proximal to distal. This means for the upper limb, for example, the shoulder is going to grow and develop faster than the arm. The arm is going to grow and develop faster than the forearm. Then it's from general to specific. So as the baby grows, it's from generally as you see, and then it's specific to eye. And okay, for example, the eye, the nose, the brain, from the general stuff that you see. Then this one, the importance of assessing this, it gives you a clue, molecular aspect, the organelle, the cell, the tissue, the organ and the organ system, for example, the nervous system. And then the person, and you see, you look at it, the family, the community, the culture, the subculture, the society and the nation, and then the biosphere. We coexist. So for the sake of and the purpose of learning, we are going to look at few milestones that we're going to look at. For growth, we're going to look at physical growth, the height, the weight, the teeth, the head, and the chest circumference. And then for the physiological growth, we're going to look at the heart rate, the blood pressure, the pulse. And then for development, we're going to look at the gross motor, the fine motor, the speech, the social, the cognitive. Then someone can ask, what's maturity? Is growth then plus development and then plus adaptations. For the neonates, following the same pattern, neonates, the normal birth weight is 2.5 to 4 kilos. Initially, there's a decrease in 10% to 12%. 10% when the baby is born via the vaginal delivery, 12% when it's via cesarean section. Then, in the first 1 week, this is what happens. It's due to withdrawal of hormones from the mother, loss of excess extracellular fluid, passage of meconium. Then there is limited food intake. Then at the second week of age, we're going to grow again. By the 10th day, we regain our kilos, and then we exceed it by the second week. Then after that, there is an increase of 30 grams per day during the first month. It's the fastest postnatal growth. Then the length, because they don't stand, so it's an horizontal. It's for the length stands in for height because they can't stand. So the boys is 50 centimeters, girls is 49 centimeters averagely. Together is 47.5 to 53.75. The head circumference, 33.35. Then the chest circumference is 2 to 3 centimeters lower than the chest circumference. We have the skull, the fontanelles, the anterior fontanelle, the spaces between the frontal bones and the parietal bones. We have the lambdoid fontanelle, the posterior between the occipital bone and then the parietal bone. And then, of course, it closes early within the first month. And then when this closes between the 12th and the 18th month. And then, of course, we have the rest like the mastoid fontanelle, we have the sphenoid fontanelle. They are not much important, but when you are assessing the increase in intracranial pressure, when a baby, a neonate is having meningitis, all these ones, they purge. So you can do assessment. Physiological growth, respiration, the rate is usually 30 to 60, average is 40. The heart rate is 100 to 160, highest while crying and lowest 100 when sleeping. The temperatures, you can take axillary, you can take rectal. 36.5 to 37. Rectal is a bit lower, gives you the most accurate. Then blood pressure is usually 75 over 42. That is it. The Apgar score, this one, we're going to discuss much about it during labor and delivery. The resuscitation of the newborn. That is a very interesting topic. For now, know that we have the Apgar score, and it can range normally from 8 to 10. And it is from the name of a doctor, Apgar. Then we have the primitive reflexes under the growth. These are the development of a neonate. So these reflexes are there at birth. You see the rootings reflex, the moral reflex, the palmogram, and the Babinski, the stepping reflex. And then we have the senses, the 5 senses. You can see them. And they are so crude. The touch, more developed in the lips and the tongue and the ears. The vision can follow objects. The hearing, ordinary, 10 days. The taste, well developed. Bitter and sour things can be appreciated. Then here the smell of the infant. The smell of the nipple is appreciated. The emotional development, not much, but pain and hunger usually expressed via or through crying. And then physical growth, 4 to 6 months, double the weight. If the birth weight was 4 kilos, at 6 months we expect 8 kilos. If it was 4 kilos at 12 months, we expect 12 kilos. And generally here, birth to 4 months, This is what we 3/4 per kilo in 1 month or per month. That's the rate. 5 to 8 months, 0.5 kilo per month decreases. Then how do you calculate the infant's weight? 3 to 12 months, you take the age of by month, you plus 9, you divide by 2. Then growth, the length is 1 to 2 inches, 1 to 1.5 inches. 2 times longer at birth by the time is 10 to 12 months. So this again, some more knowledge about it. So we have physiological growth for the infant, 1 to 150 beats per minute. Respiratory is 35 plus minus 10. Breathing is via or through the nose. Blood pressure is 80 or 50. Then we expect 4 to 6 months, the lower central incisor. The 7th month, the upper central. 9 to 11, upper and lower side. And then end of first year, 6 to 8, teeth. Now, gross motor for the infant, the head, he can be able to control it. Sitting and locomotor. At 2 to 4 months or 6 weeks, you can lift the head on lying position and move it from side to side. 3 to 6 months, the head held upright when held on a sitting position. Then they can cruise around the edge of the furniture 10 months. By 12 months, 50% of the infants are walking independently. And this is the summary of it all. Then we have the fine motor, where we can summarize them in this way. This grasping and reaching. 4 months old, you can grasp and rattle. 5 months, you can reach for objects. And then 6 months, you can transfer objects from one hand to another. Then you can finger feed at 7 months. And then you can manipulate. 5 months, the whole hand is grasping. Then there's immature pincer grasp, 9 months. 10 months, points at the bead. And then 12 months, mature pincer is fine motor. Then speech, we can take this one. 1 to 2 months, the baby coos. 2 to 6 months, laughs and squeals. At 6 months, we'll use consonant and monosyllable. At 8 to 12 months, disyllable. Tata, mama. Then here is the summary of what we've said. Then socially smiles at 6 weeks, 10 months, shows separation anxiety, and then can say goodbye. Begin to feed self at 8 months, and 12 months will drink from a cup. And this is the summary of what we've said. With this, till we meet again, thank you. Kama hii. Hii. Hii.